Errol Flynn was one of the most legendary Hollywood actors in history. He lived out a crazier life than he even portrayed on the screen. He would become famous for playing pirates and Robin Hood and swashbucklers, but he would also live out a life of documenting himself, traveling through civil wars, and he would be in love with many starlets. He would be very controversial throughout his life for all of his carousing, his affairs with underage women. He would have several heart attacks throughout his life. Even though he was a hero on the screen, the insides of his body were in pretty bad condition. He actually had an enlarged heart and tuberculosis, and even though he wanted to serve his country and be a hero, he was not able to be accepted by any avenue of the military. So he would end up, like I said, living out this life of going and writing and going to the locations of civil wars. And he would actually be a tour guide on boats in New Guinea when he was a younger man. But it would all come to an end when he was 50 years old. He would be almost penniless and forced to sell his most prized possession, his yacht. He would be up in Canada trying to make a deal on that yacht because he was so far in debt, and would unexpectedly die. People would find out after his death that he had a 17-year-old girlfriend he had been with for the last 2 years. Daze with Jordan the Lion and you all. It begins right now. So today we're going to go over his autopsy report because it's kind of interesting how there's such a detailed account of his last hours directly from the people that were around him and the physicians. He was actually supposed to be flying home to America at the time, but was experiencing shortly before his flight some chest pains and had asked for some help from the person he was staying with. And so several hours later, the woman he was traveling with, Beverly, would find him unresponsive, and Errol would eventually be found dead or deemed dead on October 14th, 1959 at just the age of 50 years old. So the report of inquiry as to the cause of death for Errol Leslie Flynn. He was age 50. He was male. His birthplace was Hobart, Tasmania. Date of death, October 14th, 1959. His nationality was American. His race was Irish. And the remarks say, see the attached Vancouver City Police Department investigation report, which we do have. So it says, where found? Dead on arrival, Vancouver General Hospital, found by friends and Dr. G. Gould. The postmortem findings were myocardial infarction, which is a heart attack, a lack of flow to the heart. Then there was also coronary thrombosis, which is a blood clot that forms in the coronary artery, stopping the blood flow to the heart. There was also coronary atherosclerosis, which was also known as coronary artery disease. It's where fat deposits restrict the blood. It's usually plaque buildup that narrows the arteries. There was also fatty degeneration of the liver. He was a pretty big drinker, so that wasn't really that surprising. It's also known as fatty liver disease. It's when fat accumulates around the liver and inside the liver. Next was portal cirrhosis of the liver, which is when scar tissue replaces the healthy tissue, and it increases pressure on the portal from the organs to the liver. Now, lastly, it was diverticulosis of the colon, which are small bulging pouches in the digestive tract. And I guess men over 40, it's not very uncommon. So what I was kind of surprised by was the address of the deceased was actually listed as 7047 Franklin Avenue, Hollywood, California. The reason that was surprising to me is because I used to live a block away from there, and that is the Landmark Hotel. I mean, that was the address for the Landmark Hotel. So it wasn't surprising that he was in a hotel, because I did know he was out of money at the end. But it was surprising because that particular hotel is the hotel that Janis Joplin died in. So just kind of an odd little tie-in. Now, under the opinions of the coroner, it says, investigation and autopsy into death of this 50-year-old movie actor of Irish racial origin disclosed that the deceased had been staying in West Vancouver with one Mr. George Caldo as a house guest, and on October 14th, 1959, was leaving for the Vancouver International Airport, intended to fly to California. The deceased had apparently been suffering from acute low back and leg pains and requested his host, Mr. Caldo, to obtain the services of a doctor before boarding his plane. As a result of a telephone call, an appointment was arranged at the residence. So now it just lists that the undertaker were the Heron brothers, and he was buried in Los Angeles, and that this was signed by the coroner, Glenn McDonald. So we'll move on to the opinion of the coroner. There's an attachment of Dr. Gould's account. It says, investigation by the police constable and detectives of the Vancouver City Police Force disclosed no evidence of violence or suspicion of foul play, and exhaustive toxicological examination has disclosed no poison or foreign substances which could be directly associated in any way with his death. The fact that no Demerol was found toxicologically would appear to confirm that the dosage given by Dr. Grant A. Gould was therapeutic. The blood alcohol level of 0.25 would appear not to have been unusual for the deceased to have been able to handle without difficulty. I am therefore of the opinion that this death should be classified in the view of above noted autopsy findings and have been due to natural causes. So that's a little surprising because at the time he had a lot of back pain. I mean, he talked about it all the time, and he was treating it with heroin at some point. So it was kind of surprising to me anyway that there wasn't any trace of anything else. And then I do know that that alcohol level, 0.25, I know that when the doctor came to see him, I think the doctor did give him a drink or offer him a drink. So we'll get to that. I'm going to try and do the reading of this the best that I can. This is an old typed up report where it's the type is a little smeared and a little hard to read. So I'm going to do the best I can to get through it. And, but it's really detailed and really interesting stuff. So, I've went over that he passed October 14th, 1959, 6:50 p.m. Errol Flynn, with his address being 7047 Franklin Avenue, and Dr. George Caldo's address is 1026 Diarant. This occurred at around, this says October 14th, 6:35. He was Australian listed, male, 50, occupation actor, marital status as married. At approximately 6:50, an inhalator call to 201-1310 Burnaby Street, where the victim had been attended by Dr. Gould and inhalator squad. Apparently this, and some of this is abbreviated also. So it says, apparently the victim had succumbed to an undetermined attack and attempts were being made to revive him. The following persons were present at the scene in addition to Dr. Gould: Mr. and Mrs. George Caldo, Dr. W. Venor, Flynn's protege, Miss Beverly Adled, who was his girlfriend. She was 17 at the time. It says Mr. Cameron was interviewed at the scene and reported the following circumstances. He stated that he and his wife had been visiting Dr. Gould at his residence when the doctor received a phone call between 3:30 and 4 p.m. approximately. Subsequently, the deceased Flynn, in company with Beverly Adland, Mr. and Mrs. Caldo, arrived at the apartment. At this time, Flynn was apparently suffering from severe pain in his back and complained of this. So then it has the investigator names Marshall and Johnston. And here we have on the stationery of Dr. Gould, his account. Commander Glenn McDonald. So this is the coroner. Dr. Grant Gould is writing this to the coroner. It says, "Dear Sir, I received a telephone message from Mr. George Caldo of West Vancouver of the above date to the effect that his house guest, Mr. Errol Flynn, was leaving shortly for the airport and before taking his flight desired sedation for acute low back and leg pain, which had been bothering him for many months intermittently, but which had been particularly bad for the last 2 days. Owing to the fact that I had just finished my office appointments, I suggested that it would be more expedient for the patient to drop by my apartment en route to the airport and that I would examine him at this time. Mr. Flynn arrived at my residence at approximately 3:45 p.m. accompanied by both Mr. Caldo and Miss Adland. I assisted Mr. Caldo in helping Mr. Flynn negotiate the stairs as it was extremely difficult for him to flex his left leg. On arrival at my apartment, examination disclosed that he was suffering from an acute intervertebral disc syndrome with sciatic radiation producing intense muscle spasm and pain down the left leg, as well as in the lower back. This condition rendered it impossible for him to sit down without an excruciating exacerbation of the pain. Accordingly, I administered 50 milligrams of Demerol intravenously with the patient standing and supporting himself against a table. He obtained considerable relief almost immediately, but elected to remain standing with his back against the patio door, which seemed to further ease the discomfort. At no time did he complain of chest pains or dyspnea, and he seemed in excellent spirits and reminisced at great length about his past experiences. He was offered a drink but refused. Okay, so I was wrong. He didn't take a drink, but he was offered one, yeah. During this time, Mr. Caldo was on the telephone attempting to delay his flight departure. I advised against the wisdom of making the flight at this time, even though he was feeling considerably more comfortable. When he had relaxed sufficiently to be able to lie down without severe pain, I manipulated his left leg while he was laying on the bedroom floor. This produced further relief, and I suggested he remain on the floor in the lateral flex position for several minutes before attempting to resume walking. He thanked me and said he felt ever so much better. From time to time during the next 20 minutes or so, other persons present would drop in and converse with him. At approximately 6:45 p.m., his companion, Miss Adling, came running to me saying that he had suddenly collapsed, that his color was poor, and that he apparently stopped breathing. I immediately went to his aid, and while commencing to examine him, Miss Adland pulled a box of amyl nitrate capsules from her purse and quickly broke one under his nose. This was the first indication of any previous cardiac involvement, and it was confirmed subsequently by her that she had been instructed to carry this preparation, and as he had evidently suffered previous cardiac arrests or cardiac attacks. At this time, only a faint heartbeat was audible, and I injected adrenaline directly into the heart, while instructing Miss Adland to perform mouth-to-mouth resuscitation. The inhalator squad was immediately summoned and administered oxygen and further Citation from 6:50 to 7:15 p.m. The patient did not respond, and he was transferred to the emergency department of the Vancouver General Hospital, where oxygen therapy was continued for a short time following intubations. I finally pronounced Mr. Flynn dead at 7:45 p.m., although the exact time of expiry is possibly a matter of conjecture. In retrospect, it is concluded that he died as a result of a sudden overwhelming myocardial infarction of such proportions as to produce death without pulmonary symptoms. I trust this summary will serve to elucidate a few points which may have not been obscured by the press release. Grant A. Gould, MD. Yours truly. Now here we have our official autopsy report. Errol Leslie Flynn, Hollywood, California, age 50 years old. Date of entry, October 14th, 1959. Date of autopsy, October 15th. This one was actually conducted, or the report was written by Dr. T.R. Harmon. So this is the body of a well-nourished, well-developed white male, 73.5 inches in length and weighing approximately 225 pounds. On external examination, there is a red area with a slight scratch on the right forehead. There are needle punctures in the left chest, 2 to 2.5 inches from midline over the 4th and 5th interspaces. There are crusted, scaled areas on both legs. Some of these have raised palpitaceous, appeared centrose, and there are numerous scars present on both lower legs and on the knees. There are small superficial scars. They vary from 3 to 4 millimeters to 1 centimeter in diameter. There's an old healed scar in the papillomatus condylomatis area on the anterior aspect of the penis, just at the margin of the prepuce. All right, what did that mean? What is the number of papillomatomas condylomatis areas on the anterior aspect of the penis? That means he had genital warts. They found several genital warts on him. It says the body is opened in the usual manner. The lungs are partially collapsed in their respective pleural cavities. They weigh the right 540, the left 480 grams. The bronchi are marked congested. They contain a large amount of mucus. The trachea and larynx are patent. The pulmonary arteries contain PM blood clot, postmortem blood clot, and fluid blood. The heart weighs 600 grams. On section, the muscle is a reddish brown color. There is an area of infarction in the posterior wall of the left ventricle. This is an acute infarction and shows pallor and brownish degeneration and red streaking. Pallor is very marked, extending into the septum near the base. So that would be the heart attack. There are no vulvular defects. There is some dilation of the right heart. Careful examination of all parts of the muscle shows no evidence of scarring. The muscle is mottled, however, indicating degenerative changes due to poor blood supply. The coronary arteries show very marked patchy athermatous thickening with narrowing of the lumen. The athermatic plaques are large, fusiform, and nodular. Some of these 1.5 centimeters from its origin. There is a degenerative athermatous plaque with organized thrombus formed on it. This extends for 2 centimeters, and in the central area there is a recent organized dark red thrombus formed plugging the lumen. So that's all the blockage. The aorta shows patchy athermatous thickening. So that's all the stuff that we went over in the findings. The myocardial infarction, coronary thrombosis, coronary atherosclerosis, fatty of the liver, portal cirrhosis of the liver, all that stuff. The gastrointestinal tract says The esophagus and stomach show no evidence of erosion or ulceration. The mucus is reddened and congested and contains a quantity of brown fluid and mucus. There is a particle of pink powder in the lower portion of the esophagus, suggestive of it says frost, 292. The duodenal mucus is a moderately reddened. The remainder of the bowel has a normal appearance and normal content, except for a number of diverticuli in the descending and sigmoid colon. So remember when I mentioned the diverticulosis was small bulging pouches? That's what they're finding, and that's what they're describing. The liver weighs 3,450 grams. It is a pale yellowish tan or brownish tan color, and on section has a pale yellowish brown cut surface. It cuts with increased resistance, indicative of a moderate cirrhosis. This would appear to me to be a portal cirrhosis, and the surface of the liver is finely nodular in some areas. The biliary system, pancreas, and adrenal glands are not remarkable, except that the pancreas is slightly enlarged and slightly more firm than normally seen in the head of the pancreas, but the sections show a normal architecture. The spleen weighs 270 grams. It is firm and on section congested. It is a dark purple color in the cut surface. It shows only congestion grossly, but is marked. The kidneys weigh the right 336 grams, the left 330. The capsules strip with ease, revealing finely granular cortical surfaces. On cut section, the kidney is remarkably congested. The remainder of the GU tract is not remarkable. Anatomical findings: myocardial infarction, coronary thrombosis, coronary atherosclerosis, fatty degeneration of the liver, portal sclerosis of the liver, and diverticulosis of the colon, signed off by pathologist T.R. Harmon. So there you have it. He died of a heart attack that they deemed natural causes. He lived with an enlarged heart, so wasn't all that surprising. But to pass away at 50 years old, he jammed a lot of living into that life. Now, like I mentioned, he is buried in Forest Lawn in Hollywood, but he didn't want to be there. He wanted to be in Jamaica. He was happy there. He had won a hotel and a card game there and had been living there. But as we saw, he was legally considered married at the time of his death. And so because he was married, his wife at the time got to decide where he would be resting. So he's right across from Spencer Tracy up in Forest Lawn, and you can go visit him there. Thank you everyone for watching. Have a great night. Goodbye.